Hey guys, welcome. Have another painful discussion today, and most of these that I'm going to do in the first, probably 20 different videos are very close to me. These are my descriptions of my pain disorders. And so today it's about the brachial plexus injury. And pardon me as I eat, and so I take breaks as I go along here. Without getting into, I'm going to give my whole body. So I'm David, nice to meet you. I've made videos about this on a different channel over the years. And I just didn't feel there was enough. A lot of the different pain disorders I have, not a lot of information. And one of those was brachial plexopathy, as far as people explaining everything they went through, the pains and everything. There are a variety of reasons why a brachial plexus would happen. And in my case, it was, I'll just say, was unfortunate. It was caused by myself. I'd rather face the truth than not. You can take a guess. But you can see in my other videos, I have trigeminal neuralgia, occipital neuralgia, trapezial neuralgia, a torn sternocleidomastoid muscle, my major neck muscle, because I suffer with the pain-suicide disease, and I got to a very bad point in my life. So I ended up with a brachial plexopathy, partial avulsion, which means partially taken from the spine, like the nerves. And so in most cases, I think this is caused by car accidents from seatbelts, because you have your seatbelt on, all of a sudden you have quick deceleration, right? And then all you push forward. Sports injuries, sudden hit from football. I would never play football if you want to mess your body up. So my case was abnormal as far as, but I got a brachial plexopathy. And when I got it, I don't want too loud lettuce on here. I have difficulty swallowing with certain foods. When I got a brachial plexopathy, let's just say this was a very painful injury. It's been now, that would make it, so it was in 2015, so that's going on 9 years. It would almost be 9 years this year. This would be the 9th year. And when I got it, I lost, thankfully it wasn't my good side, it was my right side. And I was paralyzed in my arm. I couldn't feel anything to my shoulder, nothing. All the way down, nothing. My arm was dead weight. My shoulder, everything was dead weight. And it's atrophied somewhat. I try to keep it in as much shape as I can. But I was in such a shape that I don't know if I can resonate with other people, because I was already in a bed-bound state. I was bed and couch-bound, okay? Mostly. This was a very painful injury, but I had other injuries with it too. But this was painful. Within 2 weeks, I started to get feeling back. I got my MRI and everything. I started to get feeling back. And it was like my shoulder. I started getting shocks in my hand, like a lot of electrical shocks, a lot of burning, a lot of tingling. And I was told it was just a sign of the nerves reattaching, which is a good sign. If you have a full avulsion and stuff like that, that's horrible. This is known as, you can look this up, don't let anything else claim this, because it's just not true. This is the most painful injury a human being can get. And there's one reason for that, because where the injury takes place and why it's so painful and why it lasts for as long as it does to recover, I'll get to that, is because of how many nerve branches are in that area. I don't know what it is. It's like 12 or something. Any point in the human body. Can't mess around with those nerves. And the nickname for this pain is a stinger. It stings. I had an injury to my, like I said, all those occipital, and they didn't disclose to me in the hospital that damage, and I didn't know until like four years after that. 5 years, almost 6 years. I found it in my hospital file, and they didn't even tell me. My trapezius muscle was torn. Now there's neuralgia. Trigeminal, I think it just hit a whole lot of nerves. That's it. So, like, I had this would wake me up. I would wake up like just a couple hours after I go to sleep, and it would sting. I mean, sting as much as stinging can sting. And I couldn't move my arm. I developed frozen shoulder. And you have to remember, I was already stuck with, now it was 4 pain suicide diseases after this injury, not including the brachial plexus. Let's switch and take a look at this so I can gather my thoughts. I don't use notes. Stingers and burners. A dramatic force to the head stretches the nerves, causing pain and burning. There's obviously all different levels, right, of injury. It's always a spectrum. I'm trying to find, I guess I'll read to you. Often brachial plexus injuries occur during high-speed automobile accidents, like the seatbelts, or not even without seatbelts. But it's that seatbelt that really does the pull that causes it. Blunt trauma from a fall, violence of a stab or gunshot wound, difficult births. There's one, shoulder dystocia. People are born with something called shoulder dystocia. Difficult births are a major cause of brachial plexus nerve injuries in newborns, and they're like that for life. The nerve injuries can also, and this is a lifelong injury, but it can get better, can result from medical conditions such as inflammation, compression from growth or tumor, a nerve disease. The damage occurs when one or more nerves are pulled, stretched, compressed, or torn. The nerve injury can be an avulsion. Avulsion is pulled away from the spinal cord. A stretch, pulled but not torn, or a rupture, stretched with a partial or complete tear. Often the nerves closer to the neck are damaged when the shoulder is forced down. That happens, and the nerves closer to the armpit are more likely damaged when you're arm is forced upward above your head. In addition, athletes in contact sports can sustain transient brachial plexus injuries known as burners and stingers. After sustaining a blow to the neck and shoulder girdle region, you can see football, like that's the one, in rugby. When the arm is forcibly pulled or stretched downward and the head is pushed to the opposite side, so we're talking whiplash type stuff. Interesting, BP insult can also occur as an idiopathic unknown cause after inflammation of nerves. So let's read this. For most, I'll just call it BP injuries, only one side is usually affected, and depending on the severity and location, these signs and symptoms vary. For example, the minor damage caused by a burner or stinger can produce an electric shock or burning sensation shooting down the arm and numbness and weakness in the limb. They don't say going paralyzed. The symptoms can last a few seconds or they can last for days. I don't know what they're talking about. It lasts way longer than that. It'll last for a year. Traumatic brachial plexus injuries can present with partial or complete motor, sensory paralysis to the arm, shooting pains in the affected arm, and an ability to use all or selected muscles on the affected side. That's what happened to me. These injuries can be transient and slowly resolve over time, but can persist for longer periods, leading to permanent damage. Pardon me. I'll just tolerate my chewing. If you experience a serious injury, such as an avulsion, you may become unable to use certain muscles in your shoulder, arm, or hand. You may experience severe pain or lose feeling in the ability to move the limb. Acute injuries to the brachial plexus often warrant close follow-up with a medical professional, and that's what happened with me. Yeah, seek medical advice for sure. If it's suspected, I had an immediate MRI. I mean, these are as serious as it gets, right? Especially when symptoms persist without improvement. Additionally, you should see a doctor if you have recurrent burners and stingers, weakness in your hand or arm, or experience neck pain. I had neck pain. I'd wake up with the most horrific neck pain. Do physiotherapy, move that arm. I don't know if hot or cold ever did anything for me. I had to use painkillers, which I was on already, partially, on and off. Anti-inflammatories too. But I'll tell you, you want to rebuild your shoulder. Like my shoulder today, I've rebuilt my shoulder. I rebuilt my body from scratch, from nothing, after being bedbound for a decade. I do push-ups, 50 push-ups a day. I do dips. I won't do compound because I have a torn neck, and like these things are permanent for life, eh? And like my right shoulder is quite, it's noticeably smaller than my left, and I'm very muscular, very thin, but I'm very muscular. I've done my shoulders pretty good, and you can see the difference. Like it's quite big. You might have to get a nerve conduction study so they can test what is and what isn't receiving nerve signals. Those are very good. I had a few of those. Excuse me. Treatment, the mainstay, remains non-surgical management with close observation, symptom resolution. The physician conducts frequent and thorough exams over 3 to 6 months and performs additional testing as needed to evaluate the recovery. Partial brachial plexus injuries with a halt neurologic resolution can require surgery. Thank God, not me. And mine was bad. If your physician suspects an inflammatory process, of course, a course of pain control. You know what happened to me? I was in the hospital in a psychiatric ward, aka pain suicide disease. I did that, and that's where I ended up. And the neurologist didn't offer me anything, which was, here I was. I'd torn my neck. I had brand new brachial plexus, completely paralyzed on that side. Occipital, trigeminal, but they didn't know those existed yet. But they knew I had torn everything. She didn't offer me anything. That was kind of upsetting. Let alone finding out 6 years later in the files why the back of my head hurts so much and why my neck tears repeatedly. So be careful of opiates is what I'm going to say to you. Be careful of the effects of corticosteroids. But if you need painkiller, you know what worked the best for me? And I don't like to try to endorse, but it's kind of hard to avoid on a the pain suicide diseases and nerves and all those types of things. Was gabapentin, and those are anti-seizure meds, but for me, they help the feeling of burning, stinging, shocks. They work really well. And just to let you know, gabapentin and Lyrica are the same thing. Gabapentin was made first, Lyrica was re-engineered, and I hear a lot of trouble with that, but each to their own. For patients with a total brachial plexus injury, surgery will take place around 4 to 6 weeks after the initial injury. New advances in nerve injury are helping restore movement and function in the shoulder, elbow, and hand, which was once impossible. There are many surgical techniques available depending on the specific injury encountered. Some of these include direct nerve repair, grafting, nerve transfers, muscle or tendon, tissue connecting muscle to bone. There's just a whole lot of stuff here. When comparing injuries of the upper C5, C6, and so they'll tell you where it is located, and lower C8, T1 brachial plexus, the upper plexus tend to have better outcomes as hand function remains preserved. Be patient. Nerves heal and regenerate slowly. Remember that, okay? It's going to be slow. This is one of those injuries. This would be the longest waiting injury that I would guess. One of them. So you must be patient. Your doctor may prescribe a rehabilitation program to follow to keep your muscles strong and healthy while the nerve heals. Outcomes after sustaining this injury are dependent on the extent and level of your injury. However, given enough time, many BP injuries heal without lasting damage. You know what? I saw the doctor who saw me, who did my, the observation and testing, like nerve conduction, everything, saw me in a hospital bed. And she said that I healed very well. That's what she said. I only saw her last year for a different reason. I held back by not saying anything to her about why didn't you tell me these other injuries, because I was there for a specific reason. I didn't want to screw up. So what else would I add to this? This is a very painful injury, guys, and if you're watching this, I'm sorry that you're going through this. You're gonna have to be patient. You're going to have to be careful to take it slowly. You're going to have to, if you don't move it, listen to what I did. I was in such a bad state then, so I can't compare myself to other people. But it started to hurt so much that I started to have a horrible habit. I started to put my hands in my pockets because I could no longer walk out with my hands to my sides, because the more it weighed down, the more it ached and burned and stabbed and, all the neurological symptoms. And it became a nasty habit that I had to break, which was very tough. Like, I would have my left hand out, but eventually brought my left hand out. I'd walk around with my hands in my pockets because it hurt that much. Like the shoulder girdle type thing, right? You want to take weight off of it. Anyways, I pray for everyone who's going through this. Research carefully. Look at, actually, I'm going to take you one place. I'm just going to look at some brachial plexus medications. What do they ask you to? Brachial plexus medication, I guess. Definitely use, ibuprofen and acetaminophen. I would use acetaminophen more than I would ibuprofen, because you have to be careful of your stomach. You may be prescribed, Toradol at the beginning. You can't take Toradol. Toradol is the most powerful NSAID. It's like a miracle of the NSAIDs. It's different than all the others. And but if you're prescribed any of those things, any of those non-steroidal anti-inflammatory drugs, be very careful on your stomach. I developed 4 peptic ulcers. I may actually make a video about that later. There's so much I can make a video about. But that was after 10 years usage, which was rare. I should have got one before then. But what I'm saying is ibuprofen, be careful on your stomach, because that's an NSAID. Acetaminophen I can take every day. You can take up to 6 grams or something? I forget what it is. It's like 6,000 milligrams. So what kind of stuff are they talking about here? I'll bring you to the right stuff. So if it's that bad, this is what they recommend. NSAIDs and neuropathic, commonly used in treatment of brachial plexus, depending on the symptoms and lengths and recurrence. During the acute phase, narcotic analgesics may also be necessary. Don't use it if you're an addict, but you might not be able to avoid it. Neuropathic pain medications are useful for the relief of dysesthetic pain in the acute and chronic phase. There is no drug of choice. Medications must be tried in a serial fashion, each to their own. So again, I bring up gabapentin. You may be able to take that for a time, but I would do some research beforehand. They use that for like restless leg syndrome and psychiatric disorders, seizures. They obviously affect the neural pathways. For me, they work excellent on my trapezial neuralgia, the pain in the back of my head. This is occipital neuralgia. I don't know, I haven't really taken it away before. So, and I spread it out throughout the day. Very careful in what I do. To have a total coverage type thing. But anyways, I hope this video helps in some way. For me, I suffered. It was avulsed, partially. It wasn't fully torn. I was paralyzed for a couple weeks, and I got a lot of pain and all these strange feelings that lasted quite some time, like many months. You're gonna have to tolerate months of this, And the best thing I can recommend to you is, if you're a tough person already, listen to me. If you're a tough person already, and if you think you can, start doing range of motion as soon as you think you can. The more you move it around, because you don't want a frozen shoulder. That can hurt. It's just like it will really hurt. I'm gonna have to look up the symptoms of frozen shoulder. Let's do that, and then I'll let you go. So if you keep your shoulder in place for too long, like I said, keeping it in my pockets, right? So let's look at the symptoms. Freezing stage. Any movement of the shoulder causes pain, and the shoulder's ability to move becomes limited. So you start to atrophy, number one. Let me see here. Well, I guess it would be unfair to... It's when you start developing it, but you can develop it with this in a shorter time than what they're saying here. Let's see. How long does it take to develop? Frozen is going to come up. Three stages. Freezing stage. Any movement to the shoulder causes pain, and the shoulder's ability to move becomes limited. Okay, I guess, you're just going to have to... There it is. Can it come on suddenly? Adhesive capsulitis, and the condition can literally develop overnight. So for a condition like this, I'm guessing, but what they're talking about there is something much long-term. Like in my case, holding it in my pockets. The lining, the capsule of the shoulder becomes inflamed and stiff, causing shooting pain with certain arm movements. Eventually the shoulder freezes and becomes immobile for a few months to a year or longer. I can't get into this because I can't fully say that I understand it without reading it. But I hope this helps, and I hope you heal. What's going to matter in this is time passing. Let time pass. Figure out what you're going to do in that time with mobility. Take your time and be careful. God bless.